This show is for entertainment purposes only. Do not mistake this show for medical advice. If you or anyone you know is in need of a dentist, please contact 480-391-0099 to set up an appointment.
Welcome to our podcast. Sit back and relax. Dental Works Podcast. We're gonna share some facts. We gonna raise your dental IQ at the Dental Works Podcast. We will guide you. Put out some bad jokes before we are through. Free information here just for you. Sit back and have a good time.
Today is November 7th, 2022, and this is episode number 101 of the Dental Works Podcast, the show about learning the ins and outs of dentistry from a patient's perspective. I'm Ted Work, and that over there is Dr. Terry Work.
Peace.
Dental Works is a family dental practice based in Scottsdale, Arizona that has been providing cosmetic and surgical dentistry for over 27 and a half years. We're going to hope that the video keeps working, but if not, we're going to just power through. So
Drink it in, people.
might be video, might be audio only. We are going to figure it out. It's all good. Okay.
Too much technology sometimes gets in the way.
Yeah, for sure. Today's episode is all about the ICOI Conference 2022 Las Vegas edition. I know there was already an ICOI conference in March.
Yes, we went
year.
to the one in March.
Where was that at?
That was
That's a
in
recap.
Atlanta, Georgia.
Atlanta.
Yeah,
right.
it was great.
So this one was in Las Vegas. We were
Yes.
staying in the Bellagio Hotel and Resort and Casino.
Yes, and for those of you that don't know, the ICOI is the International Congress of Oral Implantologists,
Oh. Wow.
of which I am a diplomat.
Right.
And basically what that means is you get a bunch of implant cases and you organize them, and then you have to present and you have to publish an article, of which I did, and you have to take a written exam, and then you have to take an oral exam, and it's a whole big thing to get that. But what it basically does is shows that you have proficiency in the art of implant placement, and you know, and then you have to go to one ICOI conference every 2 years to stay current as an ICOI member. So it's continuing education, but it's fun. Vegas was awesome.
Yeah, it was a really fun experience, and on this episode, we're going to be talking about the cool advancements and the topics of speeches. I mean talks at the conference. And interesting gadgets and doodads and whatnots.
Yes, and
amongst the
for this particular conference, we took our whole staff, and they seemed to have a good time. It's Las Vegas, so it wasn't a really, we didn't have to travel a large distance.
Sure,
but it was really valuable in terms of team building and just. I've gone to these conferences a lot, and the staff is kind of, they never seem to care, but they never like, oh, Dr. Work, tell me everything you learned. They don't care. But with this one, it was great because they actually had classes to become like implant practice coordinators and lots of different stuff.
Yeah, that's cool. They there was kind of a main lecture hall, and then there was kind of a side. I don't know if you got to look into that room at all.
Sure.
But, it's quite a bit smaller, but it was definitely packed to the rafters every time. Miranda was telling me that it was definitely more suited to the people in the front office and the assistants and things like that. So, there's a lot of knowledge at a conference like this. I was happy to have actually recognized one of the speakers. I don't know if any of our listeners know about the show The Tooth Sleuth with Greg Essenmacher, but that's another show that Tidor Productions produces. And one of the guests on that show was one Dr. Payman Raisi. I don't remember the episode number, but he was on there, and it was interesting to like recognize somebody, like he was like a celebrity kind of talking, as a dental thing.
And on that topic, it's interesting because we went there on a Thursday, and actually Greg Essenmacher's son was getting married on Friday. So
we're gonna talk a little bit more about that. We'll discuss kind of what we did in Vegas and kind of the itinerary, because it was kind of messed up in the next episode. But this one is going to be more about topics from the conference that we learned, interesting new techniques that you kind of heard about, or maybe things that a lot of the things that I kind of picked up from the talks that I had to sit in, and I was
it's pretty dry. And I mean, it's true. It's like any profession. You go to these things and there's nomenclature that is specific for that particular profession. So you go there and it's like anybody that doesn't know that much about this stuff, it's just an absolute snooze fest. But for people who are interested, and the great thing about it was, and my staff kind of reiterated this, was, a lot of the stuff they saw other practices doing, or that they were giving lectures about, we already do that. And so I try to stay up to date, but not jump on every bandwagon right away.
Would you say that you are too cool for school?
Okay.
You think that's kind of
I would not
accurate
use that particular expression, because that sounds like fresh.
You already
Prince
know
of
all this. You
Bel-Air.
already done all this.
It's like, oh yeah, I should be teaching this class. Look at this guy. This guy doesn't know what he's talking about. No, so it was. But the thing is, when you've been doing this as long as I have, there's, you rarely come across major changes. What you have is just little things, little pearls of wisdom that allow you to maybe change a little bit the technique you use. And there was tons of those. And one of the things was just verbiage for the assistants and the front office people to utilize, all of us utilizing the same terminology to help patients understand the recommendations we're making. Makes it easier. It gives it a higher value. Patients are like, oh, okay, well, that's what they were saying in the back, and they're saying the same thing in the front, and that makes sense now that you're recommending this. Why are you recommending this treatment? I tell them. They come up to the front, and the front office is using the same nomenclature, and so it's nice continuity from back to front. So it's important that patients know we're communicating and working on this stuff.
Sure.
So,
Sure. That is a great thing. Now, let's get into the nitty gritty of this. What was? I want you to list off all of the topics in order that.
You want me to give each lecture that I sat through verbatim.
What was the coolest thing that you learned? What was like the most interesting, maybe? Misconception? Because a lot of the things that I kind of learned from these speakers was things have advanced. Like things you have learned were taught to you by someone who learned it in their young schooling time, right?
Sure.
So like it's maybe a few generations out of touch at worst, right? So what is one thing that a talk kind of revealed to you?
Well, the thing about dentistry, which I'm sure is true with a lot of different professions, is, it's kind of like you learn how to do something and you're kind of steadfast in, well, I've been doing it this way and it's been working for so long.
Yeah.
Some people are really hesitant to make changes in the way they do things.
Sure.
So, but the basic
Luddites
things are true. Let's say, because the ICOI is not just implant placement, but it's also socket preservation, which means if you extract a tooth, you have to manage that tissue appropriately so a patient is ready for an implant. Or soft tissue management, where maybe they have enough bone, but the soft tissue is not healthy enough or thick enough, and so you have to do a connective tissue graft or whatever. So the main idea of implants has stayed the same. You take a piece of titanium, you place it in bone, you get it to heal, and it's stabilized.
Yeah.
But then what you have to do is you have to establish systems that allow everything to have good longevity. You don't want to just have an implant. Oh, all my implants last for 5 years and then they fall out. You want it to be maintained for a lifetime, ideally.
Yeah.
Nothing's forever. But what has changed the most is the definition of success. It used to be, a successful implant was if it lasted 5 years, that because, well, now they're talking about how do we place these implants so they last much longer and are more healthy initially so that they don't get infected. Because what we're finding, one of the biggest things I learned, and I kind of already knew it, is people have heard of periodontal disease. People have heard.
You should have. You wrote the paper on this.
Yeah.
So okay, no.
I don't want to
enlighten.
I don't want
me.
to.
Sorry.
Yeah. Let me dumb it down for you,
no,
Ted.
I appreciate it. You already knew all this, so it's all good.
So, a lot of people have heard of periodontal disease or gum disease or pyorrhea or whatever. Well, there's a very similar affliction of implants. It's called peri-implantitis, and it's inflammation or infection around an implant.
Okay.
And so while an implant can't have a cavity like a tooth can, where it gets soft and breaks or you get a toothache, you can definitely have periodontal disease around an implant and then lose the implant. So one of the things, and it was great having Dr. Miranda there because she runs the soft tissue management program here, is she and I were learning little things about what other doctors do in their practice to help patients maintain healthy implants and help them kind of support their own health long term.
Yeah.
We give them this information, they do what we recommend or they don't, and then when they come back, we bitch at them for not doing what we told them to do. No,
I mean, sure.
But just little things, and whether it's like just a new little technique for cleaning around implants or whatever, or the design of the crown that you place on an implant to help it stay healthier. Mm-hmm. There's 10,000 different little things that we saw at this conference that she and I kind of discussed, that's a good thing. We'll do that. And then when we bring all that back to our practice, and our patients ultimately benefit from us learning that stuff. Yeah.
Yeah. Now, you're talking about thousands of little things. Name one of them.
One of them. Well, a perfect example is one dentist recommends a teaspoon of Clorox bleach in an 8-ounce glass of water, and then you put it into your Profi or put it into your
water lines.
Water pick.
Water pick.
Water lines, yeah. Your water pick is like a little thing that patients use that kind of shoots water at your gums, and you put it in the reservoir. So it's basically about the same concentration as the chlorine in pool water. It smells kind of like pool water. Super, super dilute, but it really decreases the bacterial floral counts in your mouth. And so that's like an easy thing, and you just tell them, use your water pick around your implant or your whole mouth, but it decreases the number of bacteria that can cause periodontal disease. That's one thing. Another thing was, and I don't want to bore people with this, but the design. Bore. I don't get it.
Like you're boring.
No.
Wrong
kind of bore.
Okay.
But the design, and again, this is going to get horribly snooze fest for everybody else, but we find it interesting because we're nerds. And so,
how about this? Let's talk about the cool, fun stuff. 3D printers.
Right.
That's a huge deal in the dental thing now, right? People are 3D printing whole heads.
Yes. No.
Whole bottom jaws. Right? Is that what it is?
Well, that's one of the things.
Might be a misunderstanding.
So, used to be you ordered models from someplace else. Well, what they've done is they've got 3D printers that use a liquid pool and lasers to print in the office.
The coolest possible connection of words you can make, sure.
Basically, you can do things in the office, makes it more convenient, and it makes it less expensive, and it just makes it more available for us.
Sure.
That's something... a lot of dentists are like, no, I'm not adding anything, especially I'm getting old now. So I'm eventually going to retire, but not for a long time. But I still find all this stuff interesting and exciting. And that's what you want. You want somebody providing your healthcare that stays curious about the most up-to-date things and doesn't get behind on the techniques.
Yeah, and we've talked about it in the past, like the cost to benefit analysis of how cool something is to like how much
return
it'll help
on
me.
investment,
Yeah, it's
ROI.
like, does it make sense for me to have this cool laser machine that I use once a year?
Right.
Like
You
and
have
it takes
to
up
do
5 cubic meters of space.
You
Like,
you have to really do your research on, is this something I'm
Sure.
going to use? And 3D printing is cool because what you can do is we have a CT machine, so you can take those CT scans and print like the person's jaw. And then you can plan your surgeries before.
Well, one of the things, so this is incredible. One of the talks that I had the pleasure of sitting through was
sitting in on.
I had a video game, so don't feel too bad for me. But it was interesting because one of the case studies that he talked about was you can buy this like laser scanner off Amazon that was like $800. It's not considerably less expensive than other equipment that dentists own, and you can use that to scan someone's face and use a software to superimpose like an aesthetically pleasing smile in there, and then that will generate a model that you can then 3D print into all-on-4 or whatever type of implant structure you have, and you can do that in a day. Laser scan to like really high quality printed temporary in a day, and that kind of stuff is incredible to me.
Well, and again, the speed, it used to be to either print or mill something, and I don't know, if the person doesn't know the difference between a printing and milling.
They're exactly the opposite.
Yeah, milling is to grind it out of a solid block, and printing is to actually spray it down and laser cure it.
Yeah.
But the speed at which it does it used to mill something would take like 9 hours to do, and now you can print it in like 30 minutes or 20 minutes. And so we're looking at the possibility of, and you can do it for like temporaries, and you can do dentures, and you can do a bunch of other stuff. The problem becomes, if you don't have enough volume to do it, it doesn't make any sense, and then you're wasting time, and you spend the money and you don't use it. So but one thing you can do it for implant surgical guides. You can do it for partial skulls so that you can practice a surgery before you do it.
I think it really is a tool that is very it's very general purpose, kind of like a computer. You can use it for so many different things, and the 3D printer you can 3D print anything. And dental material is probably pretty expensive, but it's probably stronger than
well, right. You can do temporaries and have them be really... The problem is the system we use for making a temporary for a patient literally takes me 5 minutes start to finish.
Yeah.
But if you're doing a full mouth of temporaries, for a single unit doesn't make a lot of sense.
Sure.
But if you are scaling this, then it makes more sense. And like the technique I do for wax ups is I sit down and I add wax
That's
to
where
a
you
model.
put wax on your face.
No.
And you sit-ups.
You do, I add wax to a model 1 drop at a time. So for me to do a full mouth wax up takes hours and hours. You can digitally design this, send it to a printer. It'll print the whole model for you over the patient's teeth. So you asked me earlier, what did I find that was most interesting? It's just the technology and the art of dentistry matched with the technology to make it faster and better.
Yeah.
And you can still use your creative juices to have it turn out good. So that was exciting.
Yeah.
But now you've got the really cool technology, it works, but now the hardest part is implementation into your practice.
Yeah.
How do you make it so that it fits in and doesn't get in the way of doing good dentistry?
Yeah.
It has to make me a better dentist. That's
right.
That's the criteria I always use as to whether I implement some kind of technology.
Speaking about that, the robot.
Oh yeah.
The robot in the room, the big robot in the room. Are you getting a robot? You getting a robot? No.
We're getting a robot that does podcasts.
Wow.
No, so
the funniest
So-
thing about that is they had these little dummies and they looked like RoboCop because they
Yeah.
had like metal tops of their heads, but then they had real teeth. And
yeah.
So,
So anything, and again, it
but
doesn't
describe
matter.
what the robot is. If you
So
would.
there's a couple of different ones. There's robots that will help you. You have to touch the handpiece, and the robot is like
like haptic feedback and, like-
$250,000. It's kind of hard to justify that
Does it
because
speak with a robot
the
voice, or
robot
is it-
is only as good as the person programming it. So
Sure.
part of the problem is, anybody that's seen RoboCop where that one robot comes in with a machine gun and starts mowing people down.
Yeah.
We don't want to have that happen. There's a couple
Yeah.
of there's basically robot assisted implant placement.
Interesting. Yeah.
But to be honest, I've been doing this a long time. I kind of trust myself more
Yeah.
than I trust.
I mean,
the robot?
Once we get AI going, I
Yeah.
feel like robots are going to be better at dentistry, like they are at chess. They're just going to be like 5-minute, like sit down 5 minutes, and you're going to be done.
The problem
Done. Like-
is, yes,
That's hard, but
again,
Not
back
quite
to
there, but-
just just like Jurassic Park, just because you can do
Sure.
something doesn't mean you should. And the robotic
There's
part
implications.
is cool. There's a pretty steep learning curve, and there
Sure.
are some things that if you do not set the machine up right, you can have some issues.
Oh.
But they've got fail-safe stuff. It's really safe.
Yeah.
However, just because it's cool doesn't necessarily mean it's better.
at a certain point, I would also think that like the dentist. Well, it looks like the video's still working. I would want to think that the dentist would feel bad if the machine messed up, and it would be like, I wish it was my fault, but it was the machine's.
Well,
like, you
but
wanna-
no, it is your fault.
Well,
It's
sure,
always your fault.
I mean,
because
sure,
the machine has
liability-wise, but-
the machine has no
But
malpractice.
wouldn't you feel
insurance.
better if you actually messed up instead of the machine just breaking? Or like, no, I mean,
You're watching it. And the thing is, there's two different kinds. There's one that's kind of fully guided robotic
Right.
thing where, like, if you try to tilt it the wrong way, the machine won't let you. It is like a robotic arm, like you think
Yeah.
of a one arm thing.
And that's the one where it has a screen. It looks like a video game mini game.
Well,
like,
right.
on
They're
it,
both
right?
kind of like that.
Okay,
The other one is 3D telemetry, where the handpiece has like this laser guided thing, and then you just move it around until the screen turns green and you're at the right angle.
Okay,
And then when you get to the right depth, so
Okay,
you basically
it's like a sensor on the handpiece more than a robotic arm.
right. And
theory.
I mean, there is no robotic arm. It's your
Sure.
arm. And basically you have this
become a
big
robot.
you have this big LED thing that shines LED lights on the patient
Wow.
and on you.
Okay.
And you have this LED reader
Yeah.
in your hand, and you have an LED reader on the handpiece.
Yeah.
And you put the implant drill on the handpiece,
Yeah.
and then you touch the tip of the drill to the thing on your hand, and that it scans that, and now it knows in space
Yeah.
where the tip of that drill is.
Sure.
And it
That's
knows
cool.
where the patient is.
That just reminds me of like VR. This is a
It is.
cool
It's-
implementation of
it's-
that technology.
It is. It's virtual reality that is basically calibrated.
Yeah.
So the computer knows where the tip of that drill is.
Yeah.
The computer knows where the patient is. It knows where its CT scan of the patient is in the computer. And it lines those up, and it tells you when you have the right angle and right depth and the spacing
Yeah.
between, and it's really, really accurate.
Those types of implementations of that technology is kind of the first. It's where the first really high quality stuff happens, and then as it becomes cheaper and cheaper, everybody's going to have the goggles where they can like motion track in space just from the goggles.
Right.
Like, Apple is working on augmented reality glasses. I don't know if you knew about that.
Yeah.
Like 3 or 4 years in the future, I think.
Right.
But,
Yeah,
but like,
the metaverse will be
that shit is gonna
placing.
be so
we'll be
cool.
placing implants in the metaverse.
I don't know about
and
the
thing of it
metaverse.
is, yeah. I mean, the metaverse just put legs on the guy, so it's not.
It looks like shitty Wii people.
It was
I
just
don't
like
care.
a bunch of
There's-
torsos walking
There
around
are
with
a
no
million
legs.
better
Doesn't matter.
video games.
Yeah, but back to the
Yeah.
conference where they're showcasing this stuff. And the thing about it is, you have to have the right mindset. And obviously, there's some people that jump on everything.
Right.
You can't be a dentist right out of school and buy a robot and buy a CT machine and buy this and buy all this. You don't have any patience. You have to have a practice that supports this. And like I said, it has to make you a better dentist.
Sure.
And I'm waiting. I've demoed that computer guided implant
Have you done
thing.
both of them?
No.
Okay, just
I just
the
demoed
laser
it,
one?
not on a patient. I demoed it with a mannequin, and it's really cool. However, I don't do enough volume of implants for it to make sense.
Yeah.
And it would take longer for me to use that
like,
stuff
set it
initially.
up
So
and to get it all going
it's
and
going to happen, but I have to talk your mom into letting me buy one.
After the boat, then
the
then
boat,
laser.
There's a boat, motor home, and and a house.
Electric
We're living in an
scooter.
apartment now, so
all right. Well, with that, we're going to talk a little bit more about the conference on the next episode, but we do have to get to the last segment of the episode, which is going to be our favorite one, Celebrity Smiles. Okay, so please remember, you can follow along with the images that we are seeing on the Instagram page at DentWorkPod.
Are these going to be robots' teeth?
No, we did robots in the future one, but we only have 2 on this one because we don't have a whole lot of time.
Okay,
but
no worries.
First person, incredible biopic of this person just came out, which is a movie about this person's life. Although this one is totally fake and everything in it is wrong. Because it is the Weird Al Yankovic biopic movie. It just came out and it is free to watch on the Roku channel. It's a Roku original. So we're going to be doing Weird Al Yankovic's teeth. What do those look like? Weird Al Yankovic. I love Weird Al. I think he's hilarious.
Oh, he's
great
actually
in Comedy Bang Bang. Like he's had a huge, long career.
Really nice teeth.
Does he?
He does. He's got a pretty gummy smile.
Sure.
But, he is a genius. He took...
Yeah. Well, he's a doofus, I would imagine.
He is a genius.
Sure.
He's a nerdy genius. No, you wouldn't...
Yeah.
He took something he was passionate about and turned it into...
And honestly, like his most recent album, the one that came out in 2014, the quality in those parodies is so good.
He's an outstanding musician.
Yeah, he's
great. He's really, really
the
gifted.
Accordion.
Yeah.
That's hard to play, man.
So, God, it's
got great teeth.
They're a little too gummy, but they're all natural and they're really clean looking. Super, man.
Oh, man.
Dude, he's like he's an 8.
An 8?
He's an 8. He could really benefit from Invisalign to push out the posterior teeth to fill in his smile a little bit.
I don't know if he ever had braces, but maybe.
I would say not.
Okay.
But he's an 8. He's a solid.
Yeah,
8.
they look great. They look really good. All right, for the next person, we're going to be...
He seems like somebody that brushes his teeth a lot.
Yeah.
I don't know why. I don't even know. All right.
All right. And the last person we're going to have for Celebrity Smiles today is one. You kind of mentioned Elvis a little bit. We're not going to be doing Elvis because we already did him.
Yeah.
But we are going to be doing the person who played Elvis in another biopic, which is also about Vegas. The movie Elvis. This person's name is Austin Butler. This is the person who played Elvis in the movie Elvis. Elvis. I just want to say it one more time. We saw the Bellagio. Oh, that's next episode. Anyway, what are we giving for Austin Butler's teeth?
Austin Butler's teeth.
Butler's teeth. He was in Hannah Montana for a few episodes.
Oh my gosh. That's him?
I know. He doesn't look... Yeah, that's him young. Yeah, he's got lots of weird face prosthetics. But
wait, you mean prosthetics for the movie?
For the movie in Elvis, yeah.
Now, did he do all the singing?
Although
singing
Tom Hanks, that's all real. So
did he do all the singing?
I believe he did. I
okay,
think
so
I have not seen the movie. I've heard it's weird. Like the first part of it is really weird. It's like a giant montage. I don't know. I have no authority to speak about this film.
I've seen it.
Did you like it? Did you enjoy it?
It's really good. It's really well
I've heard like the first 45 minutes are like a fever dream montage.
I don't remember.
You don't remember? Okay.
He's got pretty nice
Tom
teeth.
Hanks is fat.
Well,
in
let's
the
not
movie.
fat shame.
Well, no, in the movie, he's a fat guy. He's like a big,
Well,
fat, ugly dude.
he's
right?
pretty
He's like-
unattractive.
Okay,
so he's got nice teeth,
They look
good
nice.
smile on. He's got kind of that Elvis
What do you got?
kind of. Thank you very much. Thank you, Priscilla.
Whenever
Thank
we
you.
come up
Thank
to
you
an
very
Elvis,
much.
I have to say, we saw a really rough looking Elvis on the strip. He was rough looking. He had the cheapest looking rhinestones.
Well, did you see the Elvis in a wheelchair?
No,
He was a
I
heavy
didn't
set
see
Elvis
that,
in a
but
wheelchair.
that's-
This guy has got really nice looking teeth.
All right, yeah,
Nice smile. That's
look
a
pretty good.
his are a 9.
Oh, even
His are a
better
9.
than Weird Al Yankovic's.
Yeah.
All right, well,
Nice.
thanks for joining me, Terry, for this episode.
Terry.
Episode 1. What?
Terry. Terry.
I can't say dad because that's weird, but thank you for listening.
Weird Al Yankovic.
Thank you for listening to the Dental Works podcast. If you'd like to support the show, please give us a rating on iTunes or your podcast player of choice. If you'd like to get in contact with the show or you have questions, please send an email to dentalworkspodcast@gmail.com. We may talk about your question on the show. If you're located in the Phoenix area and need dental work, please give us a call at 480-391-0099. I'll see you next time, Terry.
Good job on the podcast. And again, we know we had requests. People say, hey, I love your voices, but man, I need me some eye candy.
Okay.
So
yeah.
that is why we're videoing those. So.
If you haven't watched,
ladies.
if you haven't watched our 100th episode, the very first video episode of the show, you can find that on the T-Door Productions YouTube channel.
Yes, tell all your friends and get
T-Door
people
Productions.
watching because just so you know, this thing is going to blow up.
It's gonna explode. But we'll see you guys next time.
Take care.
This podcast was produced by T-Door Productions. Theme song written and recorded by Neil Hathaway. Vocals by Terry Work. Sound effects provided by freesfx.com and zapsplat.com.